Hello, this is Buck, and this is my wife Candace. We're going to be doing I'm going to be testing the cranial nerve number 7 on her. Cranial nerve number 7 is actually all three. It's sensory, motor, as well as autonomic. The autonomic, I'll get right out of the way. It actually controls the salivatory as well as the lacrimal, which is the crying. So patient might, if they have deficits there, have dry mouth or even inability to cry on one side or both, depending on where the lesion's at or where it's affected. As far as sensory goes, sensory is actually pressure or pain in the tongue and larynx and in most of the throat area. It also distributes or senses taste in the anterior 2/3 of the tongue. So the first test would be, ma'am, I'm going to have you actually stick out your tongue and then close your eyes. And I'm going to place either substance A or substance B on the front part of your tongue, either on the side or that side. And I want you to tell me, without bringing your tongue back in, tell me what type of flavor you're tasting. Okay? Those four major ones, which is salty, sweet, those are those, savory and all those.
Okay.
Okay, so go ahead and close your eyes.
Sweet.
Okay. Open and close your eyes. Without bringing it back in. Close your eyes.
So.
Okay. So, deficit they would not be able to determine which one was what, and you'd probably want to test both sides with a salty and sugary on either side. Moving on to actual motor. So motor is going to be, I'm sorry about that. Cranial nerve, it actually innervates the frontalis, the orbicularis oculi, the orbicularis oris, and the buccinators. So what you want to do is actually just have them look and talk to you, and you're actually looking for the blink reflex. If they don't do that, ma'am, I'm going to hit you a little bit. You can actually, right here on the glabella, to make them actually, or glabella, to make them blink. And you want to see if there's any slowness on one side or the other. The speed should be asymmetrical. The other one, the frontalis, ma'am, I'm going to have you look up, or actually like crinkle your forehead. And again, you're looking for some asymmetry of the frontalis to make sure there's no slowness on one side or the other. Go ahead and close your eyes. That's another thing too that you want to look at, is when they're closing their eyes, do they actually have one eye a little bit open? A little bit open would elicit a deficit on the contralateral side. The next one, ma'am, go ahead and open your eyes. And what I want you to do is put your lips together and blow out, just like that. Okay, do that again, but actually keep that air inside. Hold it there. Okay, and just squeezing a little bit to see if the air actually goes out, if those muscles are strong enough. Again, also too, you can, by watching them, talking to them, you can actually see when they're relaxed, if one side of the actual mouth is lower than the other or not responding as well. Again, a deficit would be that it would be kind of looped down versus the other one up. So, and that again would tell me if there's a lesion in a certain nucleus zone, which I will go over now. The nuclei consist of the facial nuclei, which is a motor. It's in the pons. It's part of the cell bodies of the lower motor neurons, and it exits the pontomedullary junction. The second one is the salivatory superior portion. This is part of the parasympathetic. It is in the pons as well. It's a preganglionic cell bodies for the parasympathetic neurons. It goes to the lacrimal glands and the salivary, and it's efferents. The third one is the solitary nucleus, which is rostral. It's sensory, total sensory, and it's in the pons. It's the sense for the anterior 2/3 of the tongue for taste. And the last one is the spinal nucleus of cranial nerve 5. It gives sensory information from the ear canal and oral region located in the medulla.